from Thornhill.
Thank you very much, Mr. Speaker, and of course, go Jays, go. We're all very excited for this afternoon. My question is directed to the Minister of Health. Mr. Speaker, some of us may recall way back in the year 2000, the negotiation of doctor compensation when the Ontario government agreed to cover medical liability protection costs in exchange for direct remuneration. Mr. Speaker, this was considered a barter system, paying the soaring malpractice insurance costs in exchange for less taxpayer money to doctors. With this government's repeated cuts to doctors' service fees, coupled with the Liberal government's proposed Ontario retirement pension plan, is this government prepared to cover the high pension costs for medical staff in doctors' offices as you did for medical liability protection costs?
Good question. Minister of Health and Long-Term Care.
Well, thank you, Mr. Speaker. I appreciate the question. It's got many parts to it. I'm proud that as part of our agreement with past agreements with the OMA, we continue to reimburse them for a portion of their liability insurance. I think that that's something, in fact, it goes all the way back to the mid-1980s and something that every government since then has supported. But, I'm not sure exactly where the member opposite is trying to go. Our physicians, and I say this with pride, being one of them, our physicians in this province are, as they should be, the best paid in Canada. We have some of the brightest minds, the best physicians and experts providing the highest quality of health care to this province, and that's as it should be. So we're obviously in a difficult financial time. We've asked our doctors to take a modest reduction in the fees that we provide for the services that they provide to Ontarians, but they are the best paid in this country, probably North America, possibly beyond. That will remain as such, Mr. Speaker.
Thank you. Supplementary.
Thank you, again to the Minister of Health, and I would just say that I think that a lot of doctors would disagree with some of your comments. But the Minister claims that there will be no new money available to pay our doctors. This Liberal government expects the total amount paid to all our doctors collectively to remain the same year after year, with no extra money to account for our increasing population, our aging population, up-to-date medical treatments, or the rising cost of running a clinic. We certainly do not hear, for example, the Minister of Education speak in these terms. Imagine a neighbourhood school with a specific budget for teacher salaries. Now imagine this same school accepting 60 more students and requiring 2 new teachers. No one would consider it reasonable to require all the teachers at the school to give up a portion of their salaries to fund the 2 new teachers. Why then does the Minister of Health expect doctors to give up a portion of their fees?
Minister.
Well, Mr. Speaker, I'm proud to say as well that the average compensation for our doctors has gone up by 60% since we took office. And in fact, our budget, the envelope available for physicians, isn't remaining the same. It's going up by 1.25% this year. It's going up by 1.25% next year. It is increasing, but I have to say to the member opposite that I would have hoped she'd also reference our other healthcare professionals, our PSWs, which we've increased their wages, our nurse practitioners, that also we have substantial issues in recruitment and retention of our nurse practitioners and other healthcare professionals. We have to provide more funds, as we've committed to do, to home care, to mental health services as well. So we're asking our doctors, in the face of a 60% increase, far in excess of any healthcare professional, to actually take a pause, a modest reduction, so we can attend to those other priorities.